We have just one more major hill to climb before we get to level ground. Testosterone is a building block of estrogen. Your body uses testosterone to produce estrogen. These two hormones are soulmates, each trying to compensate when the other is down. When there's too much of one, the other will adjust to bring it back to normal. Imbalances, however, do occur. The state of your health and nutrition and your genetic predisposition determine the frequency and severity of these imbalances. I've emphasized the importance of the health of your adrenal glands. Well, from your 30s on, the adrenal glands progressively step up their task of maintaining estrogen and testosterone levels. The adrenals also produce progesterone and are responsible for maintaining progesterone-estrogen balance. See why these little glands are the key to the fountain of youth? As the years slip by, they do everything possible to continue the biochemistry of your 20s that is seen in youthful health from your bones to your skin. But things do go wrong. Estrogen stimulates the nervous system. Progesterone calms the nervous system. If progesterone levels are not sufficient to balance the effect of estrogen, major health issues can occur. This condition, called estrogen dominance, is all too common nowadays. The excessive use of birth control pills and the consumption of hormone-laden animal products have led to many cases of estrogen dominance. Irritability, pain, inflammation, and increased risk for breast and uterine cancer can occur when there is too much estrogen unopposed by enough progesterone. Get the picture? When estrogen is in excess relative to progesterone, inflammation, a reaction of the immune system, will occur. The biggest culprits are the foods we eat and our ability to digest them, absorb nutrition from them, and thoroughly eliminate the leftovers. Some symptoms of poor digestion and assimilation include gas, bloating, heartburn, allergies, and all autoimmune disorders. Plus, there are others. For this reason, it is my professional opinion that to heal from any issue, you must first correct digestion and elimination issues in conjunction with the specific program that is appropriate to your malady. There is an entire medical industry, both conventional and alternative, that has been built up around treating women in the throes of menopause. But ideally, you should not even notice when your menstrual cycles have stopped. It should be that smooth. As your ovaries start their retirement phase, healthy adrenal glands take over hormone-producing tasks previously done by your ovaries. You may be aware that changes are occurring, perhaps a hot flash here and there, and you may experience a little more fatigue, but you should feel nothing that affects your well-being and the quality of your life. Earlier, I said that I would discuss common hormone patterns which will lead you to determining your core hormone issues. Well, now I'm going to present you with the fun combos, hormone imbalance combinations that, when you recognize yourself, will lead you to sigh in relief as you discover that you may not be crazy after all. First, low estrogen with low testosterone. Besides the physical discomfort of this dual deficiency, the worst issues will be felt emotionally. You will likely feel dull, listless, depressed, and you will lack interest in things and even the people that are most important to you. Your significant other will be made to feel completely insignificant. You might have memory issues and trouble learning new things. Thinning and drying of your vaginal walls makes having sex painful. Low estrogen with low testosterone leads to premature sagging and wrinkling. Your breasts will shrink and begin their journey to your knees due to collagen loss. This combination also has health risks of osteoporosis, heart disease, and insulin resistance. With this combo, you experience major change in your body, mind, and spirit. There's a major impact on how you see and feel about yourself. Significant depression is likely. Second, low estrogen with high testosterone. This is a good one. You'll feel agitated, fatigued, and irritable. It will be hard to concentrate and remember names. You will have a high sex drive but feel too irritable or even hostile to enjoy intimacy. You'll scare people. Low estrogen and high testosterone causes sleep issues. You won't be able to sleep, so you'll be even more tired and irritable by day. To add to this marvelous experience, you'll develop oily skin and acne. Plus, you'll lose the hair on your head. Low estrogen and high testosterone imbalance has the greatest risk for insulin resistance, especially if your estrogen level is very low compared to your progesterone level. The third combination, low progesterone and low testosterone, is similar to just low progesterone. However, you will feel even more depressed and more unmotivated and have an even lower sex drive. If estrogen levels are normal, thinking and memory won't be affected, but why would anyone want to be lucid with this imbalance? You'll just remember how lousy you feel. Common complaints include, "My personality has gotten worse." For some, that can be a very scary proposition. "I don't have the energy to do all the physical things I once enjoyed, including sex. But I do have the energy to annoy everyone around me." More seriously, the health risks include osteoporosis, heart disease, angina pain, hypoglycemia or low blood sugar, and low blood insulin levels. This causes feelings of fatigue and interferes with your ability to concentrate. If you have low progesterone with high testosterone, combo number 4. You are easily alarmed. When the telephone rings, you jump. You'll be constantly told to stop overreacting to everything. You will have sleep apnea or just sleep poorly. You may suffer with abnormal uterine bleeding, whether it is irregular, prolonged, or diffuse. This can start in your 20s, and I've seen teenage girls with this issue. Untreated, this hormone imbalance has the highest risk for endometrial cancer. High testosterone component can lead to hyperinsulin issues, and low progesterone might increase the risk for breast cancer. Fifth on our list is low estrogen with low progesterone. Of all the hormone imbalances, this one is most likely to be mistaken for an emotional or even a psychological disorder. On this journey, the fun begins with hot flashes, vaginal dryness, poor sleep, fatigue, depression, feelings of hopelessness, and memory issues. With low estrogen and low progesterone, you will undoubtedly be wetting your pants. Physically, this combo has doubly damaging effects on bones and cholesterol levels, thus greatly increasing the chances of developing osteoporosis and heart disease. Just 2 more scenarios to discuss. The triples.